Hi, I'm Dr. John Parker. Today I want to introduce you to our non-drug treatment for autoimmune conditions using functional metabolic and functional nutritional protocols along with functional neurology. I'm Dr. John Parker, along with my wife, Dr. Alexa Parker. We'll be going over this video with you today. We're both doctors of chiropractic. We've been practicing for about 12 years. We're currently enrolled in the Carrick Institute for the Postgraduate Neurology Diplomate Program. Study functional blood chemistry, functional endocrinology, and functional neurotransmitters under Datis Karazian. Studied under Dr. Michael Johnson. He's the author of the book, What Do You Do When the Medications Don't Work? And we studied under Apex Energetics for biomedical and nutritional products for the treatment of chronic conditions. We're both quantum reflex analysis level 2 practitioners. We utilize, along with lab testing and diagnostics in our office, we also utilize quantum reflex analysis, which is a form of nutritional kinesiology. We're both pastoral medical association providers, meaning when we work with chronic condition people, you're under our pastoral medical license and we protect your privacy of your health care. Autoimmune, the big picture, okay. Parts of your immune system aren't working properly. They're either hypo or hyper functioning. Autoimmune is autoimmune. It doesn't matter what label condition you have, and there's over 90 different identified antibodies in the body. The only difference is between them is which tissue is being attacked. The mechanism is all the same. So if you're autoimmune against one tissue, statistically, you're autoimmune against other tissues. It just hasn't exhibited as a priority or sign or symptom. We use different testing throughout the country for our different types of protocols that we use. And one of them we use is cyrexlabs.com. Aristo Vajani is a PhD. He won the Linus Pauling Award for Advancement of Medicine. He's developed a lot of very applicable testing to help not only identify areas, but also help you to identify the proper protocol to help you work on them. There are many natural protocols to greatly improve your life and preserve your body. So here's some general autoimmune typical patients that are out there. People that have labels like alopecia, Hashimoto's thyroiditis, Graves' disease, multiple sclerosis, lupus, different forms of diabetes. Not all diabetes is autoimmune, but several of them are. Rheumatoid arthritis and scleroderma. So those are some classic presentations that people are identified with autoimmune. In the United States, autoimmune disease is increasing. We've replaced acute illnesses with chronic diseases. It's increasing every year. Many cases are not diagnosed. They're subacute, subclinical. They present for typical autoimmune patient will have a problem for 10 or 15 years before it actually gets diagnosed. Conventional healthcare has very little to offer besides steroids and anti-immune system type drugs. They quench down the immune system. They have a lot of consequences from higher risk of developing cancers to just downregulating your immune system and having severe infections. Conventional and alternative healthcare does not fully at times seem to understand autoimmunity. The bottom line is it all leads to tissue destruction. Autoimmune conditions is a condition where your immune system is mistakenly attacking the tissue in your own body. It's making auto-antibodies, self. It's not distinguishing between self and non-self. Now, a normal function of your immune system is to sample tissue while it's looking for foreign invaders, and it makes antibodies. But what happens is it gets higher levels of it, and is driven by different things. And we're going to go over some of the reasons that people get autoimmunity, out of control autoimmune antibodies. But the bottom line is you're sampling yourself too much and it starts destroying and attacking the tissue. So we have some strategies for dealing with autoimmune issues. We want to remove the autoimmune triggers. And triggers, we're going to go through many of them, but they're antigens. They get in your system through your barrier systems, and your immune system responds to them. And there's a whole myriad we're going to go to look at those. Determine if you're Th1 or Th2 dominant, and avoid and include stimulates to the dominant or to the weak side. It all depends on which side of your immune system is involved. There's actually several parts to the immune system that need to be in balance. You have basically a Th1 system and a Th2 system and a Th3 regulatory system, along with some subcategories of cytokines. And so if there's some imbalances in those structures that are being driven, they can have damaging inflammatory consequences. So our strategies are to remove the autoimmune triggers, determine dominance, support the Th3 regulatory system, and we use that a lot with good nutritional products, and suppress interleukin-17 activity, which is a cascade of inflammatory tissue destructive, along with INOS activity. And we're going to go through this in a minute. Autoimmune signs and symptoms. Signs and symptoms typically presented with fatigue, brain fog, definitely gut issues, numbness and tingling, especially in the peripheral extremities. Hair loss is very common, joint pain, diffuse multiple areas, multiple joints, dry eyes and mouth, and another sign of it is multiple miscarriages. Your immune system has natural barriers. So we're going to go to different parts of the immune system. The first thing is you have natural barrier systems. We have skin. First off, it prevents foreign invaders from getting inside. Your skin has enzymes on it to break down and kill foreign invaders like bacteria and funguses, parasitic invasions. Same with your lungs. Lung barrier systems. Our lungs are big for detoxifying, but they're also our barrier system. Eyes, that's how we get our tears for our eyes. Mucus, it traps pathogens. Our gut flora. And the important one is our brain barrier system. That's why it's probably on a hierarchy, it's our most important barrier system, because infections in the brain can be a tremendously negative impact on your health in a short period of time. And then you have, besides your barrier system, you have your white blood cells. And you have different types of white blood cells that are for fighting infections. So in your blood cells, your white blood cells, there's a Th1 and a Th2 system. The Th1 is the cell-mediated or the innate immune response. Those are the front line of defense against any antigen. Those Th1 system you can think of as being your SWAT team, your natural killer cells. They scout and sentinel and send information back while they attack. So if they find a foreign invader, they'll attack and they'll release and send back chemical mediators that will help stimulate your immune system to attack against an invader. Your Th2 system's your humoral immune system, or the adaptive immune response. Those are your B cell markers. They tag the invaders with antibodies for a more efficient immune response. That's the premise of when they give people vaccinations. They're trying to stimulate your B cell, your memory cells, your marker cells. And then on top of that, you have a Th3 regulatory T cells. These cells balance the communication between the Th1 and Th2 system. Th3 system is very importantly regulated by nutrition. Th17 cells, in most autoimmune patients, the Th3 system's failing, the Th1 and the Th2 system become out of balance, and it causes Th17 cell tissue destruction. They're ramped up and they cause destruction. Out of control natural killer cells. So looking at this diagram of autoimmune balancing, you have a Th1 and a Th2, and one of them becomes dominant, whether it's a Th1 dominance or Th2. When a person's dominant in either one of these systems, one side is hyperfiring or out of control, and the other side is not balancing out. Balancing these systems out go a long way to helping manage people with autoimmune conditions. Chemical messengers between immune cells are called cytokines. The more out of balance they are, the more polarization between Th1 and Th2, the more tissue destruction that occurs. And we're going to go into why, but let's look at some things that will trigger your immune system to be out of control. We want to look at dysregulation versus active antigens. So there's two things to look at when you look at somebody's immune system. Is it just poorly regulated? Or does the person have an active antigen, like an infection, that's unable to conquer, so the immune system's always triggered? So let's look at some things that cause stressors that cause dysregulation. Chronic inflammation from a poor diet. Many people have that, especially with poor inflammation because of poor essential fatty acids. Big one, bad blood sugar. Poor control of your blood sugar causes dysregulation of your immune system. Adrenal gland fatigue. They're not working properly because you have different kinds of stress in your life. Hormonal imbalances. Neurologic imbalances. Stressors causing dysregulation of your immune system. Pregnancy can definitely cause dysregulation, and that's why a lot of times people will say they got worse after having their child because their immune system changed. And low vitamin D is very common. Vitamin D, probably 90% of the people that come in and see me with any kind of chronic health condition, when I run vitamin D markers on them, they're way low. Active antigen. Your immune system is imbalanced because you have an invader in your system. Now that invader can be a chronic infection, such as in the gut. Probably the biggest area we work on with people is detoxification and fixing their guts. We see all the time when we run different lab tests, chronic infections in the gut system. Bacterial infections, viral infections, mold, and parasitic infections. Parasitic infections are tremendously stressful to the immune system, and people are always kind of freaked out when we run it and we see the parasites that they have. So infections in the gut, food sensitivities, definitely you see it more and more in the news now too, food sensitivities or gluten intolerance. Those are some things we look at. Environmental toxins, we see people that have mold infections going on because of their house, where the environment they're living in. And the most dominant thing we see with people that have an active antigen, they have leaky gut syndrome. And we're going to go through some of the testing, how we look at leaky gut syndrome. But when we find people that have that, we want to fix their gut. So toxic triggers, like we're talking about, environmental antigens. Another one, we do some heavy metal testing and detoxification. Mycotoxins from molds, candida infections, viral infections, Lyme infections, gluten sensitivity, parasitic infection, food sensitivities. So these are things we look at when we look to try and figure out, especially when people have an autoimmune condition, is what are their stressors, what is driving the problem. The scientific literature now says leaky gut syndrome is a prerequisite to autoimmune disease. And we're going to go through some of the reasons. Autoimmune disease, we talked about Th17 or Th1, Th2, and Th17, but that polarity, that imbalance, causes the release of interleukin-17 cytokines, which causes tissue damage. But that's not all. Interleukin-17 stimulates the release of the activation of the cytokine inducible nitric oxide system, which causes the severe out of control autoimmunities that people exhibit when it really gets to tissue destruction. So we're going to review the autoimmune triggers. Almost always leaky gut. Each one of these steps, poor Th3 regulation, activation of interleukin-17, activation of inducible nitric oxide system, can be regulated and greatly diminished with functional medical type of intervention. So, imbalance in your immune system, tissue destruction. Poor regulation that's causing that imbalance causes more imbalance between the Th1, Th2 system, leading to more tissue destruction. That causes activation of interleukin-17, causes more tissue damage. When that's activated for a period of time, it activates your inducible nitric oxide system, which causes the severe destruction. So we want to really prevent this from happening, and if it's already occurred, we want to reduce it from happening. The only other option really out there in the medical community are steroids and immunosuppressant drugs. This is a great alternative to work on things, and really everybody knows long-term use of steroids and immunosuppressants leads to a cascade of health and higher risk of infections and cancers. So we look at the gut. That's one in addition to removing the triggers and things, I really, really want to work hard to work in the gut. People know now because of television commercials about yogurt and things that, hey, 78% of your immune system's in your gut. Well, it is, but it takes way more than just putting somebody on yogurt to fix their gut system. So we want to look at gut inflammation and what's causing it. It's usually from an immune reaction to an infection or food sensitivity, and it produces inflammatory cytokines, which break down the barrier at the cellular level between the cells of the gut, which leads to more food sensitivities, more inflammatory cytokines, worse leaky gut. That triggers inflammatory cytokines which get in the bloodstream. They cross the blood-brain barrier system, and they react with the brain's immune cells, the microglial cells, and they activate inflammatory cascades of the brain. They say fire in the gut, fire in the brain. So the problem with leaky gut, not only does it stimulate an immune reaction and inflammatory cytokines, it also affects brain. And people start having changes in brain, changes in cognition, changes in how they're feeling, changes in how they're thinking, all the way down to changes in how they're thinking, to changes to how they're moving. So they get, again, changes in how they're thinking, changes in how they're feeling, and changes in how they're moving. So when we work with people that have chronic health conditions, we work with them from a nutritional metabolic side of the house, but we also work with them from a neurologic side of the so that they start feeling better, moving better, and thinking better. Removing the triggers. Leaky gut syndrome. We do a Repairvite-based program. It's a protocol where we put you on a special diet, and what we do is we also work with you to put you on some supplements to heal the gut. So we remove the offending triggers out of your diet. People on the Repairvite, I say diet, it's actually a food elimination. You have plenty to eat, you're not hungry, it's just we're changing how you're eating. We work on gut infections, unstable blood sugar, food sensitivities, and of course, chronic inflammation. We also in our office use, it's called a TruRife. A TruRife is a light beam generator. It helps to kill infections, viruses, bacteria. The Repairvite program is an aggressive and complete program designed to break the cycle, the vicious cycle of leaky gut, and support healing of the gut system where there's nutritional deficiencies. So we're going to talk about some things in functional medicine to give us an idea if you're Th1 or Th2 dominant, and we start to avoid and we start to supplement to balance things out. We do kinesiology testing in our office. We see what you're sensitive to. What do you respond negatively to? We also see what you respond positively to. Things that stimulate Th1. If you're Th2 dominant, those are the kind of things you want to take. If you're Th1 dominant, you're going to take things that stimulate Th2 dominance. Echinacea, garlic, vitamin C, licorice root, astragalus, maitake mushrooms, lemon balm, those will all stimulate Th1's response. Things that stimulate a Th2 response: caffeine, green tea, grapeseed extract, resveratrol, lycopene. People kind of know, hey, if I drink coffee, do I feel better or feel worse? That's really a good way to figure out also about their dominance on their immune system. We want to definitely support the Th3 regulatory system. High levels of good quality vitamin D. glutathione, which is a major, it's the mother of all your antioxidants in your body, fish oils, and nitric balance. It's a supplement that we use from Apex. So I want to go over the role of glutathione and nitric oxide in autoimmunity. Glutathione is produced in your gut, and as you get over about 30 years old, you don't make enough anymore. And so we definitely use a lot of supplementation to raise your level of glutathione. Glutathione is a tripeptide compound that acts as an immune modulator, an antioxidant, and a liver detoxification substrate. It's main protecting antioxidant for cellular mitochondria. So it protects mitochondria, which are the powerhouse energy in every cell of your body. So one of the main protectors of you from autoimmune disease and free radicals is glutathione. And glutathione exists in two different states. One state is protective and it's ready to protect you. It meets a foreign invader, it gives it up, it's protective to fight that, and then you have to recycle it with it's called glutathione peroxidase back into a usable form again. So what happens is we get an immune trigger and we get an immune response. Glutathione does its job and protects you against that stress. There's an enzyme that recycles it back to where it can be used again. If you don't have good levels of glutathione, or if you don't have the ability to recycle it back because you need some support for the enzyme, you're going to be depleted in glutathione. When you're depleted in glutathione is when it activates that inducible nitric oxide. So what happens is you're out of glutathione, it activates your inflammatory cascades, you get tissue destruction, T lymphocyte activation, and you get autoimmunities. During the stress cycle, the immune response, glutathione is converted to God damn it, stop. So, glutathione exists in two different states. In one state, it's ready to go and protect you, and the other state is donated its protective abilities, and it needs to be reduced back into the protective state. It exists in a reduced state and the oxidized state. So GSH is oxidized by glutathione peroxidase. That's when it's neuroprotective. It needs to be reduced back into a protective state by enzyme glutathione reductase. So what happens is you get an immune trigger, you get an immune response, glutathione changes its state through an oxidation process, and then it gets reduced back. That cycle goes on unless you have a problem with the enzymes that help recycle it. That's why we use a product called glutathione recycler. Once we build up enough glutathione in your system, or your glutathione is depleted, it doesn't have any more, you don't have enough glutathione to protect you from the immune response, and it activates the inducible nitric oxide state. That causes tissue destruction and the T lymphocyte activation and the autoimmunity. Glutathione, that cycle is critical. The ability to activate glutathione reductase and recycle back to gluten is absolutely critical for your protection. So the thing is, you either don't have enough glutathione or you can't recycle it back into a protective state. It's been donated already. Any environmental compound that you're triggered by, the antigens, activates the immune system only after glutathione levels are depleted. So high levels of glutathione are critical for your protective against the autoimmunity. Now we're going to talk about the role of, that's right. Now we're going to talk about the role of nitric oxide in autoimmune modulation. Nitric oxide is an important messenger molecule involved in many physiological and pathological processes. It's a double-edged sword. It plays destructive and protective roles in autoimmunity, depending on which isomer is expressed. Nitric balance is a product that we use, and it provides compounds to support the expression of the different isomers of nitric oxide. ENOS and NOS are the good ones, while dampening the expression of inflammatory nitric oxides. So the bad ones. You have to have a healthy balance of nitric oxide to help the body. It helps to support tissue healing, dampens tissue inflammation and destruction, and modulates your autoimmune reaction. So not only do we work by protecting you with the glutathione, but we work to start balancing out those inflammatory pathways. So we worked on the glutathione, the nitric oxide balance, and how do we fix leaky gut? We talked about the repair protocol. What happens is we get a vicious cycle of leaky gut, we get intestinal inflammation, loss of the tight intestinal junctions, entry of antigens and peptides into your bloodstream, and they create your immune response, and they create multiple food sensitivity. So you have to break the leaky gut cycle. Leaky gut, brain, and lungs, those are the big barrier systems you have to work on. They allow substances in the areas where they shouldn't be. One of the definitely things they create are widespread inflammation. It's like pouring more gasoline on the fire. Repair protocol for leaky gut, it's a regimen that requires dietary program changes to support intestinal membrane healing. The dietary restrictions are not caloric. They're type of foods, not quantity of foods. But you can eat all you want, you can only eat certain things though. So autoimmunity is a metabolic problem, and it involves many bodily systems. And the other side of the coin is the neurologic impact it has. So my wife, Dr. Lex, is going to take over here. She's going to talk more about metabolism and the neurological consequences for having problems with autoimmune. Thank you.
Hi, my name is Dr. Alexa Parker, and today I'm going to be talking about the neurological component to autoimmunity. So first we'll start out with, what is metabolism? Basic metabolism is that you eat food and you derive energy from that. And one of the largest organ systems that we need energy for is actually the nervous system. So out of all these other systems, your nervous system requires 30% of the energy produced through metabolism. The nervous system consists of the brain, the spinal cord, the nerves, and if you have a cellular problem, a metabolic problem because of autoimmunity, meaning blood sugar regulation or inflammation or gut issues or food sensitivities, all of that can significantly impact the brain in a really negative way. And some of you may already see that, from your lack of ability to focus, your lack of motivation, your lack of ability to concentrate. These are all brain-related symptoms. And most of the patients that we see with autoimmunity will see brain fatigue and also misfiring. So we actually do an evaluation for that, and we'll be talking about that today. So how the brain works is, for example, if we have sensory input on one side of the body, for example, if someone touches our left arm, or if we have pressure or vibration on the left arm, that input actually travels to the right side of the brain, or the right cerebrum. So that's how we receive input into the frontal or brain areas of our body. It is sent to the opposite side of the upper brain, which is the frontal, parietal, temporal, or occipital lobes. So each has a separate function. For example, if we receive touch on the left side, that will travel to the right parietal lobe. If we receive visual input on the left side, that will travel to the temporal lobe or occipital lobe as well. If we move on the left side, which is the left cerebellum, it will actually affect input into the right side of the brain. The upper brain has a major connection to our brain stem. If that area fails, if it starts to diminish, it can actually affect our brain stem to the point where it's unable to inhibit sympathetic responses. So that means that our sympathetic nervous system, our fight or flight, is able to take over, okay? So that means we feel the stress response. We fatigue very quickly, all of those symptoms of fight or flight. So as our brain begins to break down, that sympathetic nervous system takes over completely, and it's very difficult to heal in that type of response. Okay. So when we have an overfiring sympathetic nervous system, it contributes to chronic pain and chronic fatigue. We also see irritable bowel syndrome, urinary tract infections, chronic pain, pain fibromyalgia throughout the body, migraine, tension headaches, poor posture, and adrenal gland stimulation. We also see blurred vision, increased sweating, difficulty staying or falling asleep, dizziness, vertigo, heart palpitations, high blood pressure, all because of an overfiring sympathetic nervous system. When we see cerebellum fatigue, we often will see a problem with balance. We'll also see things like vertigo, chronic neck and back pain, headaches, clumsiness, dropping things, disorganized attention, and a lack of output to the upper brain or frontal, parietal, or temporal lobes. When we evaluate patients, we look at this particularly in the way of looking at balance, the way they move their right and left arms. We may do things like finger to nose type evaluations to look at a person's cerebellum. We may also have them close their eyes and stand straight, or march in place and close their eyes. These are just very simple ways to look at their cerebellum, see if it's working properly, see if if they have a lack of oxygenation or fuel to the cerebellum, which is really causing it to fatigue. Another area that we look at is the frontal, parietal, or temporal lobe fatigue. This is again this results in a lack of inhibition of sympathetic nervous system. So when the frontal, the parietal, the temporal lobes are malfunctioning, we can't inhibit that sympathetic response again. So when the higher brain's failing, we can't inhibit sympathetic responses again, so we can't heal. We're in this chronic, stress type of mentality, basically. When the upper brain's fatigued, we have things like depression, anxiety. So this is kind of like lack of activation of those frontal lobes and the higher brain. We have difficulty scanning pages while reading, difficulty adding or subtracting, difficulty with verbal expression, difficulty understanding language, really decline in memory, learning disabilities, and lack of focus. We also see altered sensation. So for example, when we examine our patients, we may test the right side versus the left to see if it feels the same. That'll tell us if there's alterations in sensation, so numbness, tingling, changes in handwriting as well, anger and increased irritability or impulsivity, body weakness, lack of motivation, learning disability such as dyslexia and ADHD. How did this happen? Basically, this occurred as a result of many chemical stresses, physical stress, emotional stress. All of those cause brain fatigue and cause fewer nerve impulses. Some of the things that also contribute to it are things like anemia. If we have problems in our gut, we're not able to break down our food properly, we can develop anemia, and particularly patients with autoimmunity develop something called pernicious anemia, which is an inability to bind adequate iron in the GI tract, and also blood sugar imbalances. You may not have a diagnosis of diabetes, but there's definitely fluctuations that we see from hypoglycemia to insulin resistance that are still a problem for patients. Food sensitivity, so sensitivity to wheat, casein, soy, these are some of the drivers that can actually contribute to autoimmunity. The immune system imbalance, as my husband mentioned. So I see that a lot of times actually. Patients are taking, for example, echinacea or golden seal or these things to help them with their immune system. However, if they're Th1 dominant, they're actually taking things that are actually making them worse. So it's so important to really determine the correct herbal or nutritional product, or remove some of the things that are actually causing it to be more hyperdominant, so that we don't really offset that Th2, Th1 balance for the individual. Poor diet, definitely inflammatory diet, high in omega-6 versus omega-3s. Hypothyroid function, chronic inflammation, and hidden infections, particularly in the gut. These are metabolic problems that can create nervous system imbalances in the brain. Emotional stress is always a big one. People with autoimmunity, again, any kind of stress can really impact the adrenal glands. And the adrenal glands are two glands that sit on our kidneys. Basically, in response to stress, they make a hormone called cortisol. if we have significant stress over a period of time, that cortisol starts to actually break down our gut barrier and our brain barrier system. This leads to more feedback basically into more autoimmune conditions and more pain and more inflammation in the body as well. High insulin and glucose levels cause breakdown of the brain and nervous system. So high insulin and glucose levels will begin if we start to really break down our adrenal glands, because the adrenal glands will act on blood sugar regulation. The cerebellum and the brain really require two things to function properly. They require fuel, so properly functioning blood sugar. Good glucose levels should be between 85 and 100, and that's fasting. We need oxygenation, and we also need to move. So we talked about how if we move the left arm, that can impact the right brain. If we move the right arm, that can impact the left brain. So when we evaluate people neurologically, we may actually do specific type of neurological activation to basically really activate the brain and get it functioning more adequately. Have you been told that your lab tests are all normal? Lab ranges are inaccurate. Bell curves are used, versus functional lab values are more sensitive to reveal the underlying problems. What we use are these, basically. We use functional lab ranges, so they're much narrower than the lab ranges that you normally receive from your medical doctor. And in order to be in the functional range, for example, for blood sugar, we want you to be at 85 to 100, as I mentioned. Traditional lab ranges are 65 to 110. So that means that they're really missing the fact that someone could be hypoglycemic or insulin resistant. Same for TSH. We see so many patients that have autoimmune thyroid, and they've been told that their thyroid's normal. However, again, functional range is 1.8 to 3.0. Someone could have hypothyroidism or hyperthyroidism, and again, it could not even be detected because this range is so broad. Also, so those are some of the examples, and we really, look at you in we really dissect basically the root causes so that we can get you better. And this is what it takes in order to really restore health in someone with an autoimmune condition. We have to really delve deeply into what's causing your problem. Again, so we do some testing. We do a complete metabolic panel. We look at things like thyroid antibodies. We look at hemoglobin A1C, which tracks your blood sugar over about 3 months. We look at cholesterol. We look at the immune cells. We rule out anemias. We also do saliva testing, and this is for adrenal function. We also may look at female sex hormones and male sex hormones, along with cortisol, which is that hormone produced by your adrenal gland, which can affect your sleep and wake cycle. We may do a stool ecology profile. We find that people with autoimmunity, we really have to focus on the GI tract, the gut system. For care, you must be committed to your health. On a scale of 1 to 10, 1 being very low and 10 being a yes, I'm only looking for patients that are about a 10 out of 10. So you have to be really serious about getting well. This type of care involves taking action in your health, really changing your diet, taking supplements, coming in to do some treatment. So we want you to really be actively involved in your care. Medicare and our secondary insurance only pays a small portion of the care plan. You basically have to invest in your health. We have made our care plans affordable, though, let me just fix that one, okay? We have made our care plans affordable so that 96% of the patients that come to our office are able to receive the care that they need, receive this treatment. The next step, if you truly feel that you're ready to change your life, the next step is for you to fill out our new patient chronic health condition paperwork. This can be downloaded from www.synergyfixme.com, and then call and schedule your case review, 813-254-5200. All paperwork and prior labs must be received at least 24 hours prior to your appointment, and we look forward to seeing you in our office so that we can help you regain your health.